I was looking for a program with lots of options. I wanted a program with a university hospital, public hospital, VA hospital, psychoanalytic institute, treatment-resistant depression, and all of the fellowships I could possibly desire.
Here at Emory, not only do you become competent in utilizing psychopharmacology and psychotherapy, but you also get the opportunity to work with experts in ECT, ketamine infusion, and neuromodulation. In addition, if you're so interested, you get the opportunity to work with one of the experts in DBS.
An overwhelming strength we have is the opportunity to train and work at Grady. I mean, the variety of pathology on display there is phenomenal. I mean, we would routinely see catatonia, NDMA vasculitis, neurosyphilis.
At the VA, I really learned how to manage trauma and stress-related disorders. I was routinely surprised by veterans coming into the ED with flashbacks or, coming in after a fireworks show. At first, I didn't know what to do, but in time, I learned how to speak with them and how to get them to engage in treatment.
In choosing a training program, a reason to give strong consideration to Emory would be its excellence in the three domains of community psychiatry, psychodynamic and psychoanalytic therapy and theory, as well as neuroscience, with the certainty that whichever domain you choose to pursue as a resident, you will be at a place that can meet your needs with excellent facilities, reputation, and faculty in all three of those domains.
We have a lot of strengths in our training program that I think applicants will find appealing. We have a lot of diversity here at Emory with a variety of clinical sites and variety of patient populations that residents are exposed to during their clinical rotations. We have very dedicated faculty members that are leaders and innovators in the field, and residents have an opportunity to work with the faculty members doing some groundbreaking research.
We have a number of residents that are doing very exciting research, from the genetics of treatment response in post-traumatic stress disorder, to looking at the structure of language in adolescence to determine whether we can find certain patterns in language that will allow us to predict the development of schizophrenia.
Deep brain stimulation and transcranial direct current stimulation and low magnetic field stimulation. These are all new treatments that are presently experimental and under research protocols, and residents can participate in these research protocols both in the research track as well as in doing research and electives in their third and fourth years.
We use different kinds of imaging technologies, whether it's PET scanning to map brain metabolism or MRI to look at brain structure or function or white matter, and now even EEG to actually integrate and study brain circuits that go wrong in depression.
They go to the Fulton County Jail, evaluate some inmates there, sometimes on pretty serious charges. They author the report. Potentially they could get called to testify on it, so they get all that. In addition, they go out to the inpatient forensic unit and they get involved in the civil work that we're doing, so they sort of get a taste of what it's like.
We have what I would feel is a wonderful family-like setting for our program. We are passionate about making sure that our residents are well taken care of so they feel supported going through a tough residency, because it is tough going between internal medicine and psychiatry.
Right now I have about 5 mentors who have really been instrumental in my career development, and I think this is important because the general residents also get this same very strong mentorship that I had as a junior faculty member.
When they first come in, they're very, would you say, green, and then when they're, just about ready to graduate, they're very sure of themselves, they're ready to take on the world.
I do believe that one of the greatest strengths at Emory is the department's focus on truly integrating a biopsychosocial perspective. We have faculty who represent diversity of perspectives, biological, psychopharmacological, cognitive behavioral, psychodynamic, existential humanistic, family systems, integrative, just to name a few of them. Given the work that I do at Emory and the fact that I'm past president of the American Psychological Association, I have the opportunity and the good fortune to travel throughout the country and go to medical schools and departments of psychiatry. And that has really helped me be certain and confident in my assessment that we have one of the best departments in the country.
Your opportunities for growth, your opportunities to really become a first-class psychiatrist are just there waiting for you to grab.
These were conditions and things that I wasn't going to see anywhere else. And I felt honored and excited to get to take a part in their treatment.
It's been a really rewarding experience just getting to see how the changes we can make in people's lives really do impact their everyday.
I remember talking with my wife frequently. We actually had this talk, but when we go back and say, would we choose Emory again? Would this be the place that we wanted to go? That'd be right for our family, be right for me and the training and the goals that I have professionally. I absolutely, hands down, realize now that this is the right thing and I would do it again.